I'm Dr. Melanie with Venture Chiropractic. Today, we are going to continue our conversation regarding torticollis in infants and children. As a refresher, torticollis is a shortened SCM muscle that attaches at the base of the skull to the breastbone or sternum and the clavicle, causing this muscle right through here to be shortened in the child, causing them to tilt to one side and turn away from the side of the head tilt. Some of the symptoms and why it's important for treatment and how we're going to diagnose torticollis is what we'll cover in this video. So to start, symptoms. This is important information that I tend to gather from the caregivers visually. Reduced range of motion and tightness or a little lump that the caregivers may feel in the neck of that child. It's about a pea-sized little bump, can help us identify that that muscle is shortened. Looking at pictures, maybe the first signs that parents notice that their child is always in the same position, how they are when they're lying, going to sleep or playing on their backs, if they are only looking at toys or turning to sound on one side of the body, over here, for example, that is something that we want to correct and treat properly, because it's very important that children develop in a symmetrical way, utilizing both the right and left side of the body. Other things that we might see are changes of creases. Creases tell us a lot. You may notice changes of one eye being bigger than the other, more of a crease on one side of the face, creases in the neck, often a shoulder may be higher than the other. Those can help us identify what side the shortened muscle is on. Flat spots. This is a common area. Parents want their children to have nice round heads, and as soon as they start to notice that the hair on the back of the head, either in the center or off to one of the sides, starts to disappear, we may have a flattening on the back with more prominence or a bulge happening on the opposite side in the front, kind of in the frontal bone or by the eyebrow. That can help us identify that there is a reduced range of motion happening in this child. In your older children, they may complain of pain. Sometimes these are brought on by a trauma or an injury, whiplash, a fall that may cause this muscle to spasm and tighten. And with those, they may have pain. Older children may present with a fever as well. And so if fever is present, a virus is involved, those are other reasons that we want to take into consideration of what is causing this torticollis. So why is it important? Short-term, flat spots on the head, we want to get that corrected so the child can improve their range of motion in all directions. Their field of vision, their milestones and gross motor skills can develop symmetrically, utilizing the right and the left side at the same time. A retained ATNR, or asymmetrical tonic neck reflex, is a newborn reflex that is present in all children. It is also known as the fencer reflex. This should integrate and go away at set time in that infant's life. And if it is retained and held onto, that child will not be able to roll from front to back to front in both directions equally and symmetrically. This will cause a delay in crawling and walking, which are extremely important gross motor skills that we want that child to experience. So identifying the head tilt and the restricted range of motion early can help us continue to meet those milestones. Core strength can be affected. If they do not have proper head control, they cannot develop the core muscles of their midsection and their lower back. And then, of course, visual tracking. We want their field of vision to develop on the right and the left so that they can take in everything around them in an equal fashion. Balance, if we are not able to have core strength and gross motor control of our head and our body, balance can be affected. And we may see this in children that are maybe a little bit more clumsy. When they're going through milestones, crawling may look different, not in that all fours position. These are things that we want to address, and it could all be stemming from this initial neck tightness that we saw. Chiropractor, occupational therapist, physical therapist, medical doctor, massage therapist, family members are all individuals who can identify this, but making sure you get to the right medical professional that you feel comfortable with is really important so we can start treating. In our office, what we do when we start our visit is just to get to know mom, dad, baby, kind of the family dynamic. How old is the child when they're presenting will give me a better idea on how long I may expect treatment to take. What the birth looked like. Were there any interventions? Was there vacuum, forceps? Was it a really long birth or really short birth? That can tell us a lot of what type of pressures were put on baby when they were being born. Was baby born via C-section? Was it because of a ill position when they were in the uterus, whether we were lying transversely or breech? That can have a big effect on how gravity was causing development of the SCM muscle to happen. Does baby have a fever, or is there a current illness happening? Do we have a tongue or a lip tie on board? How is nursing, whether we're feeding via breast or bottle feeding? What does that look like in the child? Gathering all this information can be so important in, again, providing recommendations for home care, how we're going to treat, and things that we're going to share in the office for position management to help baby reduce this tension in their neck. Then I move on to the physical exam. Once I gathered all that medical information, I check range of motion. We have kind of these fun little blinky balls. Depending on the age of the child, I may have some toys. I have a little monster that I use with my finger, and we just see how baby can turn. Does it look equal? Where are the restrictions? Using our voice can also be a good motivator for children. I palpate and feel on the neck. Now, there are no big movements. I'm using very gentle pressure. I'll feel down the neck muscles right through here. I'll do little wiggles or tick-tocks. Tick, tock, tick, tock. We turn and we turn. Try to make it fun and engaging for the child and talk to them throughout the whole visit so that they also know that this is a safe thing that we're doing. And once we move through the visual appearance, the palpation, checking range of motion, I will look at asymmetries in the face, back of the head, and then also I'll check their hips. I will evaluate by moving the leg in and out if there's clunking, clicking, extra movement, restricted movement in the hips, because hip dysplasias can go hand in hand with torticollis. And then I'll do a quick little screen in the mouth to see if there's any tongue or lip ties present that would warrant a referral for a proper diagnosis that those structures may be contributing. It is really important as well, if imaging was performed, a CT or an ultrasound at a medical provider's office, to share that information with us, because that'll give us even more details on how we should proceed. If you like and want to learn more about how we treat in the office for a torticollis and some home exercises, stay tuned. Our next video will cover that information. So like and subscribe to our channel. We'll be providing many more helpful tips on how your children can move better, feel better, and they can be the best version of themselves. Thank you. I'm Dr. Melanie with Venture Chiropractic.